Right. Okay, thank you. So the clinician has some actions to play, the microbiologist has some actions, the hospital administration person has, and of course the government, the pharma industry, and so on and so forth. So while we are supposed to improve the life of the current antibiotics by infection control, surveillance, antimicrobial stewardship, the microbiologist plays his or her own role. The administration tries to implement infection control policies. There's a waste management program, which also has important role. And then the drug manufacturers have to give us good drugs, and the policymakers have to give us good policies. And of course, uh, at every level, we have to prevent infections. So at the community level, the infection prevention is very clear. We need sanitation, we need clean water. So even all this Swachh Bharat Abhiyan is also equally important. Then we have vaccination. We have seen what vaccination did when we had COVID, how it just drastically dropped the levels of COVID infection. Similarly, we have vaccination for many diseases, and these should be implemented as much as possible. For example, people taking even influenza vaccine is a good step to prevent a lot of community-acquired pneumonia. And when they don't come into the hospital, then you preserve your antibiotics for many other diseases. As far as hospitals and healthcare organizations are concerned, disinfection, sterilization, hand hygiene, isolation of infected patients, antimicrobial stewardship. And repeatedly, I'm talking about waste management because this is very important. The way we contaminate our environment is by throwing waste anywhere and everywhere. So it's very important to have a good waste management program at the hospital level. So all this we try to do, improving the life of current antibiotics by cycling, assure and ensure adequate drug levels, using older drugs which are not fit to use or withdrawn, combination therapy, and most importantly, outpatient parenteral antibiotic therapy. So this is a concept that is coming up in the last decade or so. We used to use it a lot in pediatrics when, patients just needed to complete their antibiotics. We used to send them home with the cannula. And that is exactly what this big principle is. That basic premise is that hospitalization leads to colonization, and that leads to more infection. So discharge patients as soon as possible, continue parenteral antibiotics on an outpatient basis, decide on dose, route, and duration before discharge. And of course, whenever they come, we need to monitor whether their IV line is patent, whether the patient is generally doing well, whether there are any recurrence of symptoms, and whether there have been any adverse effects of drugs. Finally, the judicious antimicrobial use, the several rights, the right patient, the right drug, the right dose and route, the right duration, and finally the de-escalation. This is extremely important. We need to do it every time we prescribe an antibiotic. This needs to be thought of in our mind. Now, hospital antimicrobial stewardship is not just talking about antimicrobials. This is a very important concept. This is an interprofessional effort across all departments. It is for the best patient outcome with least toxicity and minimal impact on resistance and the environment. So basically, it is driven not just by the clinician, but it is driven right from the administration. So we need to have a good hospital antimicrobial stewardship program. It is not just you and me who can do it. What is the role of the microbiologist? The microbiologist should provide rapid infection diagnosis. Why is it? Because remember that if you have a reliable method of diagnosing infection, then you would not be using a lot of empirical therapy. So you first start with a rapid and reliable methods which will help the clinician in streamlining therapy. At the secondary and tertiary level, you may use very hi-fi techniques like next-gen sequencing or Malditor. But at the primary level, inflammatory marker assays, and those with chromogenic tests should be the focus, because these are cheap tests, they require minimal infrastructure, and they can be game changers in the diagnosis of infections. Pharma industry plays a big role, actually. They are supposed to ensure proper drug quality, promote research on new drugs, promote the development of reliable rapid diagnostics and newer effective vaccines. Unfortunately, the pharma industry is not so committed to antimicrobials because, as I explained previously, it is not at all profitable for them. It is much more profitable to them to have lifestyle diseases drugs. Policymakers need to ensure environmental sanitation, clean drinking water, vaccination, regulation of available drugs, national antimicrobial policy, encourage and fund research in infectious diseases. I don't know how many of you are available. There was a time when antibiotics were just not labeled. Now at least antibiotics come with a label on it saying antibiotic. But even that has not deterred people from starting antibiotics empirically all the time. Now, what is the One Health approach? That is integrating the health needs of humans and animals, stop antibiotics to animals for growth and as prophylaxis, minimize antimicrobial use in agriculture and aquaculture. Now, what does the future hold? This is where I think there's a lot of exciting work. It is not only antibiotics. Today, we have a lot of drugs which are not antibiotics in the true sense, but can help us in killing bacteria and fungi. So what are these newer therapies? So these are all non-antimicrobial antibacterial therapies. Phage therapy, we have all heard of bacteriophages. So phage therapy can make a difference using lytic enzymes found in the saliva and mucus. So actually crystallizing, distilling the lytic enzymes out of these and then using them, because we know that they have a lot of antibacterial properties. Inhibit quorum sensing. This is another very novel therapy. So what happens is bacteria talk to each other when they are in a biofilm. They talk to each other, and this talking to each other is very essential for them for their survival. So bacteria form big groups into a biofilm, and this quorum sensing is essential. So if quorum sensing is inhibited, perhaps these bacteria die out. Nanoparticles, silver and gold nanoparticles, these are entering the bacteria and killing them. Antimicrobial peptides, these are very important, and now a big role of antimicrobial peptides or lipopeptides is coming up, and it is virtually impossible to develop resistance to them because they target the bacterial membranes. And efflux pump inhibitors, we heard a lot about efflux pumps and how they are playing havoc. So efflux pumps inhibitors. So as I said, quorum sensing, microbes communicate with each other and exchange signaling chemicals. These chemicals act like autoinducers and allow bacterial population to coordinate gene expression for virulence, conjugation, apoptosis, mobility, and resistance. So why quorum sensing? A single autoinducer from a single bacteria is ineffective. A particular threshold colony density is required to start this process. And hence, if we can break this quorum sensing, bacteria are perhaps not going to be able to form biofilms and work in groups. So potent method of inhibiting bacterial virulence, some have been found to be naturally occurring too, some are synthesized, and animal studies have shown promising results in vivo and in vitro. Now, this is not all. You will find enough more of this in the Lancet Infectious Diseases Journal. There is an organization for Center for Disease Dynamics, Economics and Policy, with one center in New Delhi, and Ramanan Lakshminarayanan is the director of it. He writes amazing articles on this topic. And of course, we saw this review of antimicrobial resistance by Jim O'Neill, which was shown on day one by either Dr. Ankur or one of the others. So there is a lot of material on this. And if you're interested, you can always go up and read up. Now, India has come up with some national treatment guidelines for antimicrobial use in infectious diseases. This is also freely available, and it does give a guide to what antibiotics to start in sick patients when they come with a certain kind of infection. So guidelines are based on infections, what infection, and based on that you can choose. Similarly, the Indian Society of Critical Care Medicine has made extensive guidelines on what antibiotic to use in what disease. So to summarize, antimicrobial resistance is playing havoc in medicine. As part of the medical community, we have a responsibility to ensure that we don't go back to the pre-antibiotic era. It is a One Health approach which is urgently required, and we all should be committed to it. With those words, I would stop here, and I know there will be no questions, but I really encourage you all to kind of go back and read up a lot about this topic, because